Doctor, I've been thinking about it for quite a number of years from now, but was too scared or shy. Patient is awake but comfortable, or sometimes we need a short sedation. So what makes it all these procedures safe? That this is the most important part. But sometimes minimal discomfort post-procedure is experienced by few of the patients. Are cosmetic gynec procedures actually safe, or is it something risky that people don't talk about? Hi, I'm Dr. Shruti, a fertility consultant and a cosmetic gynecologist practicing at DyuSculpt Clinic, Mangalore and Kanyanad. Many women are actually curious about fears that stops them from even asking about these procedures. Let's break this down. Honestly, you can make an informed decision about going ahead with these cosmetic gynec procedures. The first thing to understand, these concerns are completely valid. Fear of anesthesia, fear of pain, and also fear of complication and the fear of judgment about getting done these procedures. Many patients who come to us often say, Doctor, I've been thinking about it for quite a number of years from now, but was too scared or shy to actually come out and ask about these procedures openly. These procedures are actually more common than you think, but awareness is still low and discussion between the group of people is quite low. Let's address the biggest fear initially, that is with starting with anesthesia. Commonly, what we use in these procedures is local anesthesia. This is a low area is numbed locally only. Patient is awake but comfortable, or sometimes we need a short sedation. That is, patient is relaxed, sleepy, but is totally unaware of the particular procedures what we are doing. Then next comes the final anesthesia or the regional anesthesia. This is done for only selected cases. It's for more extensive procedures or a more long procedures. Before any procedure, we do a proper medical evaluation including history, clinical examination, blood test, whichever basic blood test, whatever is required. Vitals are also checked, medical fitness for procedure and anesthesia is taken, and then patient is proceeded for the proposed procedure. So during the procedure, we usually, as I told you, anesthesia is given in any form. Either some procedures, some laser procedures, you don't need anesthesia. Whenever require local, final, or a mild sedation. So because of these things, no pain during the procedure is felt. But sometimes minimal discomfort post-procedure is experienced by few of the patients. So today's anesthesia techniques are quite advanced and tailored to each patient, making them quite comfortable, safe, and definitely in the proper qualified hands. So now coming to the next concern, that is recovery of these procedures. So this is actually where the most of the myths are actually existing. People think recovery is quite long, difficult, and painful, but most of these procedures have immediate recovery. That will be sometimes will be mild swelling, slight discomfort, and occasionally tightness. These are expected and usually well controlled with simple oral medications. Now coming to next is the downtime of these procedures. Many procedures are daycare. That means you can come to the hospital, get your procedures done, and go home on the same day. So routine activities can be started within 2 to 5 days post procedure, but for full healing, sometimes some of the procedures might require 3 to 6 weeks of time, depending on procedure to procedure. Coming to the lifestyle precautions on your day-to-day activities, we always usually advise to avoid strenuous activity for some time. Maintain proper hygiene and obviously follow your doctor's instructions strictly, because that is told for a reason. Following post-procedure care is just not as important as the procedure itself, but it helps a lot in your recovery phase and reducing your complications. So you won't be bedridden for any of these procedures, but yes, you do need to give some time to your body to heal itself with all these procedures. Now coming to the next concern, that is the risks of these procedures. This is important because no medical procedure which is done other than normal is of zero risk, and we all know it. So common but very mild effects might be a little swelling or bruising might be there, temporary discomfort might be there. These are a part of any medical procedures what we undergo, and it's a part of normal healing process. Now coming to less common risk, that is infection, delayed healing, or minor asymmetry whenever a labiaplasty or a labia augmentation is done. So these are usually preventable with proper techniques and aftercare treatments also. Now coming to the rare risk, this sometimes patient might need a revision procedure if they are not happy or satisfied, or a prolonged discomfort or a pain. This risk is not from the procedure itself. Procedures done in a non-medical or unregulated settings carry significantly a little bit of more higher risk, and that makes for you to make an important important decision of where and by whom a procedure can be done with. So what makes it all these procedures safe? That this is the most important part. That is right patient selection. That is by the doctor. What we tell is not everyone needs every procedure. There are so many patients coming to our OP and asking, I want this procedure, I want that procedure, whereas it have been totally normal. So we do sometimes reject some procedures also. So here comes your proper consultation is the key to understand that particular expectations and procedures. So obviously a well-informed doctor or a well-concerned doctor will definitely tell you when to and when not to do a procedure. So and now next is your reducing complications is by the right technique and the right technology. So it's all customized approach is what we rely on. That is, one treatment cannot be advised to every patient. Every individual is different and every concern is different. So probably the technique or the technology or the laser machines what we use might be different to each patient. So use of appropriate devices, precision in surgical steps, and or when and when required, combination therapies, that is laser plus surgical, sometimes might be advised to you. So next is going to a right setup and a right expertised doctor. So having said this, what all you need to see when you're selecting your right doctor or a right place for your procedure. That is sterile OT theatre or a procedure room, qualified team. It's not only the doctor, it's the anesthetist, their staff, and all these things matters whenever you're doing a procedure. Sometimes if it's a little major procedure, emergency backup also, if required, must be needed. So a proper medical setup is non-negotiable whenever you're planning for any of these cosmetic gynec procedure when it comes to safety. And also experience of the surgeon plays a major role. So don't just get it done by a non-qualified person. Make sure you're going for a qualified person for this particular cosmetic gynec procedure to avoid complications. So remember, these procedures are not just about appearance. They also often improve comfort, confidence, and quality of life. So these are the points which you need to consider whenever you're going in for these cosmetic gynec procedures. So definitely if you've ever been hesitant or because of fear, don't let that misinformation hold you back. So obviously open up about your concerns, get a proper consultation done, understand your concerns, and then take your own time to decide about if that procedure is required, not required, or can be postponed. Definitely these are not emergency procedures. So obviously take your own time, take a reasonable, sensible decision about your cosmetic gynec procedures.